Hello and welcome. Today we're diving deep into a common yet often uncomfortable topic, enteritis. We'll explore what enteritis is, what causes it, how it affects your body, and most importantly, what you can do about it. So, let's get started on understanding this digestive system disease. Enteritis isn't a single disease, but rather a term used to describe inflammation of the small intestine. Its causes are varied. Viral infections, like those from norovirus or rotavirus, are frequent culprits. Bacterial infections, such as those caused by Salmonella, E. coli, or Campylobacter, can also trigger enteritis. Parasitic infections like Giardia are another possibility. In some cases, enteritis can be caused by certain medications, toxins, or even autoimmune conditions. Now, let's talk about how enteritis affects your body. When the small intestine becomes inflamed, it disrupts its normal function. This inflammation damages the lining of the intestine, reducing its ability to absorb nutrients and fluids properly. This malabsorption leads to diarrhea and can contribute to dehydration. The inflammation also triggers increased intestinal motility, further accelerating the passage of contents through the gut, worsening diarrhea and potentially causing abdominal cramps. Enteritis is a widespread condition, affecting people of all ages and backgrounds. However, certain populations are at higher risk. Young children and the elderly are more vulnerable to severe complications due to dehydration. Travelers to regions with poor sanitation are also at increased risk of contracting traveler's diarrhea, a common form of enteritis. Outbreaks can occur in closed settings like schools, nursing homes, or cruise ships, where infections can spread rapidly. The signs and symptoms of enteritis can vary in severity, but they often include diarrhea, which can be watery or bloody. Abdominal cramps and pain are also common. Nausea, vomiting, and loss of appetite may occur. In more severe cases, you might experience fever, chills, and dehydration, leading to dizziness, weakness, and decreased urination. It's important to seek medical attention if you experience persistent or severe symptoms. Diagnosing enteritis typically involves a combination of factors. Your doctor will likely start by asking about your symptoms, medical history, and travel history. A physical examination may be performed to assess your hydration status and abdominal tenderness. Stool samples are often collected and tested to identify the causative organism, whether it's a virus, bacteria, or parasite. In some cases, blood tests may be ordered to check for signs of infection or inflammation. In rare situations, a colonoscopy or endoscopy might be necessary to visualize the intestinal lining and obtain biopsies. While enteritis broadly describes inflammation of the small intestine, it's helpful to categorize it based on the underlying cause. Infectious enteritis can be further classified by the specific pathogen involved: viral, bacterial, or parasitic. Radiation enteritis arises from radiation therapy affecting the abdomen. Drug-induced enteritis results from certain medications irritating the gut lining. Autoimmune enteritis is a component of inflammatory bowel diseases, IBD, like Crohn's disease, impacting different parts of the digestive system. The treatment for enteritis focuses on managing symptoms and addressing the underlying cause. For mild cases, rest and adequate hydration with oral rehydration solutions are often sufficient. In more severe cases, intravenous fluids may be needed to correct dehydration. If a bacterial infection is identified, antibiotics may be prescribed. Anti-diarrheal medications can help reduce the frequency of bowel movements, but should be used with caution and under the guidance of a doctor. It's crucial to avoid certain foods that can irritate the gut, such as dairy products, caffeine, alcohol, and fatty or spicy foods. Probiotics might also be recommended to help restore the balance of gut bacteria. Preventing enteritis involves practicing good hygiene. Wash your hands frequently with soap and water, especially after using the restroom and before preparing or eating food. Ensure food is cooked thoroughly and stored properly to avoid bacterial contamination. Drink clean, safe water. If you're unsure about the water quality, boil it or use a water filter. When traveling to areas with poor sanitation, be extra cautious about what you eat and drink. Consider getting vaccinated against rotavirus, a common cause of enteritis in infants. The prognosis for enteritis is generally good, with most cases resolving within a few days to a week. However, complications can occur, particularly in young children, the elderly, and individuals with weakened immune systems. Dehydration is the most common complication, but in severe cases, it can lead to kidney failure or shock. Researchers are continually exploring new ways to prevent and treat enteritis, including the development of more effective vaccines and therapies targeting specific pathogens. Ongoing studies are also investigating the role of the gut microbiome in the development and treatment of enteritis. Understanding the complex interplay between the gut flora and the immune system may lead to novel approaches for managing this common condition.